हाय एवरीवन, गुड मॉर्निंग। आज हम डिस्कस करेंगे इंटरेस्टिंग टॉपिक जो कि काफ़ी कॉमनली पेशेंट्स में देखा जाता है, दैट इज़ लाइपोमा। ना लाइपोमा एक न्यू ग्रोथ है दैट इज़ यूजुअली कंपोज्ड ऑफ फैट टिश्यू एंड इज सिचुएटेड आइदर इन द कोरियम और द सबक्यूटेनियस टिश्यू. It usually begins as a soft, flabby, fatty mass that may vary in size from either a small nodule to a large mass that weighs several pounds. The skin that covers this mass is usually red, thick, or it may be adherent, and it is often seen that it is either movable and usually normal in color. Now these fatty tumors can be either of two types, that is a diffuse type or a circumscribed type, that means it is localized at one part of the body. Now they may occur on any surface of the body, but usually they are located on the neck, the back and the buttocks, and once they are removed they usually don't reoccur because they are very slow growths and also they are painless. This diffuse type on the other hand is less common and it is usually associated with larger areas of the skin, and it may surround or merge with the normal healthy tissue as well. Now a rare form that is known as a fatty neck involves usually the neck and is often seen only in the male subjects. Now here we need to differentiate this adipose tissue or lipoma tissues mass from adiposis dolorosa, which is a more rare and severe form that is an independent affection characterized by large, irregular, nodular, diffused fatty deposits in the subcutaneous tissues of middle-aged women. Now by the gradual involvement they may extend practically to the underlying muscular tissues as well. So जब ये muscles को भी involve कर लेता है then that may result in muscle weakness में pain, उस muscles में change हो सकते हैं उनके temperature and tactile sensations में, and if the nerves also get involved with that then there are nervous disturbances and hemorrhages from the mucous outlet. This adiposis dolorosa is a more malignant form of lipoma and it has a fatal termination. Now what is the pathology or the etiology of this lipoma? Now when they are circumscribed they are usually seen in women and especially adult women, and the diffuse forms they are usually seen in the adult men. Now excessive fat formation is also seen. Why that happens? Because the fat जो deposition है वो patients जिनके अंदर की angina, angioma, carcinoma और sarcoma की history हो, या फिर कई cases में जहाँ पे patients के अंदर high cholesterol levels और high heart disease की conditions present हो, उन cases में ये conditions are more seen. माइक्रोस्कोपिकली जो है ये फैट ग्लोब्यूल्स के मासेस होते हैं जो कि एक लोब्यूल में अरेंज्ड होते हैं टुगेदर विद द ब्लड वेसल्स एंड दे आर सराउंडेड बाय अ कनेक्टिव टिश्यू फ्रेमवर्क. नाउ डायग्नोसिस. दिस शुड नॉट बी डिफ़िकल्ट बिकॉज द डायग्नोसिस इज सेल्फ एपरेंट. ईज़िली डिफ्रेंशिएट हो जाती है ये कंडीशन बिकॉज जो मास रहता है लाइपोमा का वो सॉफ्ट होता है, लोब्यूलेटेड रहता है और पेनलेस रहता है, और ये ईज़िली मूवेबल होता है अंडर द नॉर्मल स्किन, विच इज़ वेरी करेक्टरिस्टिक ऑफ लाइपोमा फ्रॉम अदर ट्यूमर्स. नाउ व्हाट इज़ द प्रोग्नोसिस और इसका क्या ट्रीटमेंट रहता है? यूजुअली क्योंकि ये बिनाइन ट्यूमर्स हैं और पेनलेस ट्यूमर्स हैं, so they do not have any bad prognosis by themselves except discomfort and their appearance that may appear in some other body parts that may cause cosmetic issues with the patient. But इसके अलावा इसमें ज़्यादा कोई दिक्कत नहीं होती unless that changes into adiposis dolorosa, जिसके अंदर की अगर muscles involve हो रही हैं और other surrounding tissues they are getting affected, then due to the pressure effects from the lump patient may have pain or discomfort or other associated symptoms with that. नाउ द यूजली जो एलोपैथिक में इसका ट्रीटमेंट रहता है दैट इज़ यूजली सर्जिकल, दैट इज़ दे एक्साइज द ट्यूमर एंड दैट इज़ मोर देन इनफ टू रिमूव द मास, and once they are removed they don't usually reoccur because it is a very slow growing growth. However कुछ cases में high frequency currents भी दिए जाते हैं patients को with liquid potash that is freely diluted in some 1 to 3 doses 3 times a day, which is also suggested in some cases. Now what is the homeopathic treatment for lipoma? Now in homeopathy there are medicines that can help with the tumors. There are some very good medicines available that according to if there are some underlying causes that are seen to be associated with the disease condition, then those conditions can be first treated and ultimately the lipoma can be treated. Now since it is not a very difficult condition और इसके कोई pathological suffering नहीं रहती है patient को, it's more of a cosmetic issue in patients. So इसमें पेशेंट्स को यूजली यही राय दी जाती है कि इसको एक्सरसाइज कर दिया जाए, बट अगर पेशेंट नहीं करवाना चाहता एक्सीजन देन देयर आर मेडिसिन्स दैट they can take for about a month or so and for continuously for a few weeks, and sometimes these lipomas they get dissolved by themselves with the medicines. However, if they are very large tumors or lipomas, then we have to take the constitutional treatment of the patient, like what exactly the patient is suffering from, how this condition started in the patient, what are the symptoms the patient is suffering, or is it simply a cosmetic issue the patient is having. और अगर इसके अलावा उनको कोई और दिक्कत आती है लाइपोमा के करके, कई बारी देखा जाता है कि इस रिस्ट पे पेशेंट्स के हो जाता है ये कंडीशन, तो उनको लिखने में दिक्कत आ जाती है, या कई बारी उनके मास जो है वो उसको प्रेशर कॉज करते हैं तो दे हैव डिफ़िकल्टी इन राइटिंग. सो इन दोज केसेस मेडिसिन सच एज सुरूटा आर वेरी हेल्पफुल to remove the issue with that. Then there are some other medicines that are also useful, such as abrotinum if the patient is having lot of small masses of lipoma over their whole body. In that cases it is a very good medicine. Then medicines such as calcarea floor or calcareo floor is a very good medicine that can be given to the patient to reduce the size of the mass. Then also we have to see into the medical history of the patient, like are there any causative issues such as sarcomas, any kind of cancerous growths before or in the family history, or there is some nevus or some angioma present in the patient. So these all conditions we have to see and treat them accordingly to help with the main condition, that is the lipoma. So this was a small lecture on lipoma or the fatty tumors, which are very common nowadays, especially in the younger and the adult population. And once they are treated with the proper medicines, then they can be completely removed by medicine as well as by surgical excision. So I hope you had some good information about this condition, and in case you like the video, please like and share, and have a great day.